Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our Plática called Take Action LA County. With me today is our esteemed co-host Ana Chavez Mancias, NALBA's Program Director. She'll be introducing herself here shortly. NALBA is a nonprofit agency dedicated to the well-being of Latino individuals, families, and communities across the United States. Our mission is to address the disparities and the barriers affecting the behavioral health of Latinos. Today, we are excited to present our Plática series called Take Action LA County on reducing stigma and connecting community health resources to help those who need help and recovery. Plática is the Spanish word for conversation, so we'll be having a conversation today with our presenters who we'll introduce here in just a second. Of course, today, we want to highlight their work and be able to have them share about the services that they render and how you can connect to their services. And it's important that we acknowledge that every mental health agency or provider in LA County is here to be of service to you as our residents in LA County. NALBA would like to thank the County of Los Angeles Department of Mental Health for making this series possible. Each month through the end of this month, we'll be hosting these Pláticas in order to really bring attention to these resources and how people can benefit from the services available. So we're looking forward to having you join us throughout today's session so that you can ask questions and be able to share comments live on Facebook. And so we know that the road to wellness and journey might begin today for some of you, but we'd like you to encourage you to reach out to our presenters and they'll provide that information today during our Plática. So let's begin by having our co-host Ana Chavez Mancias introduce herself, and she'll introduce our presenters. And then right after that, we're going to get started with our first set of questions. So Ana, good to see you again. And we're going to have you make all the formal introductions, including yourself. So go ahead.
Thank you, Fred. So nice to see you again, too. So hello, everyone. My name is Ana Chavez Macias, and I am the program director for the National Latino Behavioral Health Association here in Los Angeles area. I live in the beautiful city of San Dimas. Prior to me joining NALBA, I worked for Pacific Clinics for over 19 years, providing direct services that were bilingual and bicultural to family, children, and youth. And I also supervise teams that provided direct services as well. Now, allow me to introduce our wonderful guest today. I am super excited to have my friends here from Amanecer. And first, I'm going to introduce Emmanuel Reyes. Emmanuel Reyes, he is the director of the Children's Department at Amanecer Community Counseling Services. He has over 8 years of experience working with different populations, which include families, children, and court-mandated adults. He spent 5 years working with children and families and has developed a specialty in providing PCIT services, received his MFT from California State University of Long Beach. So welcome, Emmanuel. And now I'm also going to introduce my colleague, Diana Guerrero. She is the director of the Adult Programs and Trauma Recovery Center at Amanecer Community Counseling Services. She is a licensed clinical social worker with over 8 years of experience working in foster care, mental health, and victims of crime. She received her MSW from the University of Southern California. Go Troyans. I just have to do that shout out there for my own school, and is passionate about advocacy, leadership development, and providing supportive services to individuals in need. So welcome, Diana, as well. And Fred, back to you.
Well, that was a great introduction. I noticed that you got a smile from Manuel and Diana when you do those introductions. So thank you, Ana, for doing that. And more importantly let's get started. So Diana and Emmanuel, we want to get to know who you are. So we got to say a little bit about your background in the organization, but really what we want to do is get to know each of you a little bit more so our listening audience could get to know you, right? That opportunity for you to say a little something so that folks can get familiar with what might happen should they call you right? And so, Diana, we'll get started with you, and then, of course, over to Emmanuel, and then we're going to move forward with additional questions. But Diana, otra vez, bienvenidos. Good to see you and good to have you here with us today.
Thank you so much. Good afternoon, everyone. Thank you for the warm introduction. I'm very excited to be here. This is an important conversation, that needs to continue to happen. I'm very excited that there's this space here to have these conversations. A little bit about myself. Thank you. Yes, social work. I'm very passionate about social work. It has been something that I have been passionate about for a really long time. Just advocacy, especially for individuals or populations that traditionally would not access or maybe do not know how to access services that can be there to assist. I started my career working with foster youth, and that's a really difficult population to work with, working within Department of Children and Family Services, working with very unique situations in Los Angeles County. And I quickly grew to love, the advocacy work. There's so much that could be done with those populations. And I moved into the leadership role here at Amanecer, and it has been a wonderful experience to be at the leadership here, particularly during a difficult time, which is COVID, coming in to provide mental health services during a pandemic. And so that was another barrier. What you can expect if you reach out to me is I'm going to take action. I'm going to find out what the situation is. I like to hear both sides. So typically, because of my role, I tend to hear all the complaints, or I tend to hear when things are not going well. That's when I step in. And I like to do a good job of hearing and trying to understand what the need is. Because there's usually, if there's a concern, there's always a need that's driving that concern. And so for me, I am an advocate true and true, no matter where in the role I am. And I really do believe in the core values of social work. And so I think a lot of people that have worked with me know that you're going to get the direct truth from me. And that is something that I really do value. And that's something that I bring with whether I'm interacting with clients, with other staff, or other leaders. Thank you again for having us here.
Yeah, absolutely. We can hear your passion, right? And so, of course, social workers, they're great listeners, first of all, but they're also incredible problem solvers, right? And so when you do that, and then you have people who come to you, your sense of helping and healing is going to definitely come across. So we're going to enjoy hearing about the services and how you all deliver those services. But Emmanuel, we want to get to know him too. So, here he is, right? He came prepared. He may have brought a video or resume or something, but we just want him to kind of speak from the heart and share with us a little bit more so people can get to know him. So, Manuel, go ahead.
Yeah, well, even though I did bring my resume, I don't think I'm going to share that because I think my boss, who may or may not be watching, may not actually appreciate that. I may be, promoting myself like that. But thank you, Anna. Thank you, Fred, for the introduction. So, as Anna said, I am the director of the children's department here at Amanecer. I started here with the agency back in 2021, like Diana said, still right smack in the middle of COVID. I started as a program manager, and I've been very blessed with the opportunity to move up to my current role. Just kind of a little bit about myself. I started off doing my practicum and internship, and really started getting more experience with therapy and working with court mandated adults. So everything from people who have been charged with domestic violence, both perpetrators and victims. Individuals that have been charged with child abuse, individuals who have been court ordered to take anger management classes. So really, I really feel like I got a good chunk of experience of how to deal with different issues, different family dynamics very early on. And then, after that, 5 years with working with children, which I honestly found to be, again, like it was a different learning experience. And I feel like I really grew, and that's really where ultimately where I realized that I want to take the lessons that I have learned as a therapist and, you know, teach them to other therapists, which ultimately led me to my leadership role here at Amanecer. So kind of, you know, so when you call me, definitely what you're gonna get from me is, you know, a sense, you know, the sense that someone is on this, the sense that I'm trying to get to understand the reason why you're here, trying to get to understand who you are as a person. That's how I function, in more of like let's just have this one-on-one conversation and just kind of get to the root as to why you're here. What's the goal that what is the goal that you are trying to achieve, and what can I do, or what can my agency do to help you ultimately reach that goal?
Wow. Well, it makes me want to come to you now because I'm going to say, yeah, boy, I have these needs and, but it's the way that you approach us that's important, right? You're welcoming, but more importantly, and I think you said it best, right? How do I create a relationship with the person I work with? How do I relate to them, their reality, their circumstances? And when people hear and feel that, they tend to open up, in light of the fact that they're in an environment which maybe they've never been to. But it's exciting, Manuel and Diana, to hear a little bit more about yourselves. And so we're going to have Anna now ask you the next question, because now we're going to want to learn more about the organization and start to kind of explore what that looks like in your organization. So Anna, please go ahead.
Thank you, Fred. So our next question to you both, and you guys might want to like a split. I know Amanecer offers a lot of different services. Not sure if you guys actually offer PCIT, which is parent-child interaction, right? So talk about all those great services, tell our audience about those, and who do you serve, right? So tell our audience about all the great services Amanecer has and who it is that you're serving. And why don't we swap it this time around, and let's start with Emmanuel and then we go with Diana.
All right, thank you. So here at Amanecer, specifically in the children's department, so we have various programs. So it's our MAT and birth to 5 program. So MAT specifically is working with children who have been recently removed, or who have been recently removed from their homes, and our MAT therapists go out into the field or get in contact with the families to do a very thorough assessment to really determine what needs the child and family needs, and then they would do a referral to make sure that the child and family are linked appropriately. And in the birth to 5 program, so with that program, we specifically work with children who are newborns up to 5 years old. Currently, we don't offer PCIT. Is something that I'm currently actively working on to try and have that here in the agency. But we do offer a CPP, which is child parent psychotherapy. So with that program, it's really focusing on the relationship between the child and the child and the parent, and really trying to help the parent work through any kinds of issues that they may be bringing on from their childhood that could be ultimately influencing their parenting style, or if there is a trauma that they have experienced recently that again may ultimately be influencing their parenting style. So in addition to that, we also have our school-based program, which our school-based therapists go out into the community, to schools that we have contracts with through LAUSD, and they provide therapy services in school. So that definitely allows us to capture, to really provide services in the school. Gives us the opportunity to see some of the clients in the environment where they may be having a lot of behavioral issues, or where maybe a lot of the stressors could be coming from. Because with COVID, and even prior to COVID, going to school could be very stressful due to bullying, just maybe having any kind of learning disability that may be causing stress that leads to behavioral issues. And now ultimately, with everything that's unfortunately that's been happening in schools, like prior, before, schools used to be a safe place, but now like that really is seeming to be less and less the case. So that's where our therapists do an amazing job in going in there and really helping our clients, problem solve, figure out coping skills that they can use, and really try to set them up for success long term. We also have our outpatient, our OCS program, which deals with higher needs, with children that whose behaviors are a little bit more severe. They do come with a team that not only helps the client but also helps the parent, because if you're a parent and if you have more than one child,
Right.
dealing with one specific child who may be having some more severe behavioral issues could be very, very overwhelming. So we do set them up with a team to not only help the child but also the parent. And lastly, we also have our RAP team, which deals with children who definitely need a little bit more attention. Again, their behaviors, their symptoms could be very extreme, and this comes with an even bigger team. So there's multiple people involved. So with every family, there comes a therapist, a case manager, parent partner, a facilitator, and a child and family specialist, all geared towards helping not only the child, but the family and the parents to make sure that the child succeeds, but also that the family succeeds as well. And just lastly, really, I know there's like a lot of programs we have here. Lastly, we do have our prevention and early intervention / outpatient program, which deals with children whose symptoms are low to moderate. So I think in our day-to-day, all of us experience some kind of anxiety, some kind of depression. So this program specifically is geared towards for those that just need to do a check-in, making sure that and just teaching us how to cope with the day-to-day life, with the day-to-day life stressors. Because I mean, even though we are in the middle of it, sometimes all of us need that check-in every once in a while, to just talk to someone and just to vent or unload, because there's maybe some things that have been impacting us that we may not be fully aware until we actually start talking about it.
Absolutely. Wow, you guys have a full spectrum of services, right? Very impressive. Depending on the need, right? It could be from very mild symptoms, like you're saying, like that, just that check-in, all of that, to like very severe symptoms where you actually have a RAP team, right? RAP services are some of the most intensive services that we have out here in California. So, and it is a great tool for families, like you were saying, not only to help the child, but also to help the family, right? Because sometimes with the child's behavior, there has been a lot of damage made to the family as a whole. So not only the child needs healing, but also the family. So wow, wonderful services. Thank you for sharing all those wonderful services that you guys are offering at Amanecer, Emmanuel. And I hope that those listening are thinking, this is a place that I can go, because it serves a full spectrum, right? It doesn't matter where you are in that spectrum. You can come to Amanecer and you can get that help that you need. Diana, did you want to share a little bit? I know you are in the adult program of Amanecer, and it is so wonderful that Amanecer has children programs and also adult programs. So let's hear about the programs that you're offering for adults.
Sure. Emmanuel, I love you. You're so passionate. You talked about each program. And
Yes.
really, we want to highlight all the programs. Amanecer is a community-based agency. We're in downtown Los Angeles. So when the question is, what services do we provide? We truly provide community-based services. We have different programs, just as you said, and it is a spectrum of services. So the way I like to describe it is that no matter where someone is in terms of their need, whether this is the first time you've ever needed mental health services, perhaps this is the first time you're accessing, maybe this is the first time you're having a DCFS case and you need services for that, or you've been receiving services for a really long time, your needs are very high, You're also probably dealing with maybe needs with housing, maybe needs with unemployment. So depending where a person is at, there is a program here at Amanecer that can help you. So it really is a spectrum. In the lower end, as Emmanuel said, we have our prevention and early intervention. So the adult clinic mirrors very much the children clinic in that we have similar programs. It's just depending on the age. If we have someone that's a little bit higher need, maybe they're navigating more needs in terms of services, then we're going to go into like the outpatient, like Emmanuel shared about the outpatient, very similar in the adult clinic. If someone perhaps, maybe recently was hospitalized, maybe there's in need of medication, maybe needs housing, then we're going to go into our higher end programs. In the adult, the equivalent of the wraparound is something called full service partnership, or FSP. So really, Amanecer offers mental health services through Department of Mental Health. We also have a contract to provide services for survivors of domestic violence. This is a program that is very case management driven. So it really helps survivors of domestic violence to have self-sufficiency. They receive mental health services. One of the great things about Amanecer is it's not just therapy. Your team includes your therapist. It includes a case manager who is advocating, navigating to have all those resources. We have nurse practitioners, we have psychiatrists. So you really get to have this really comprehensive team. We just recently started a housing program, specialists who can help navigate housing situation, which is a huge issue here in Los Angeles County. And most recently, one of the other programs that I oversee, which is a newer grant that is to our agency, it is the Trauma Recovery Center. This is through the California Victims Compensation Board. We were awarded a pretty significant grant to be able to provide trauma-informed services to victims of crime. And so this is very different than traditional mental health services. This is very geared to really help survivors navigate having witnessed a crime. And at Amanecer, as early as 0 to 5, you can receive services, or we go all the way up in age. And so it really is an agency, and a really great agency where no matter where you are, there is a program here that can help provide support.
Wow, how excellent. And I love the fact, Diana, that how you were explaining, right? That the adult services pretty much mirror the children's services. And that is wonderful to hear, because I know sometimes adults have such a hard time having those same services. Children tend to get a lot more services than adults do. So the fact that you guys have something that mirrors, in intensity and need for the adults, just the same as children, I mean, it speaks highly of your organization and your commitment to helping them with their mental health problems or issues that they may be having. So how wonderful to hear about all these great services, and thank you. And I hope that our listening audience is taking notes, because we got a lot of acronyms, right? Like FSP and MAT and RAP, and so all these acronyms, they have a name. It's and it's a specific service. So, but wonderful services. Thank you for sharing that with us, Fred. Back to you.
Well, it's so great to be able to hear about the work that you're doing, first of all. And we want to do a little shout out to Lupita and to Dolores, who have already started to put some comments in there. And Lupita says, just real quick here, she says, she wanted us to know that this is her first webinar on this live series. So that's great that she's found us and is here today, and we have other folks that are listening. So we want to give a shout out to all those that are on live, and more importantly is that the information that gets shared here will be recorded as part of this particular Plática. So after today, we're going to continue to ensure that other people get to hear this information, and so that other folks can also go into the chat and ask other questions or comments. So Emmanuel, Diana, we encourage you to go back into the Facebook page and have a dialogue with people even after today, because what happens is that, the folks that can influence others oftentimes are the people that are the ones who want to hear what's happening, want to know what's available, because they will oftentimes broker it for their friends, their family, their primitos, right? Because in some parts, right, some folks are a little shy or reluctant, but that doesn't mean that they don't want help. It just means it's the approach that we use to do our work that is effective, which I think, Emmanuel, you really hit the ball out of the park, So you might as well play for the Dodgers, because I think you said it best, right? It's particularly effective with Latino populations, right? Is outreach, outreach, outreach. Do the work in the community, right? Because of the fact that oftentimes people are accessible, people are there, and oftentimes available to you in ways, like you said, with the school centers, right? And then, of course, and both of you really spoke to this, family, family, family. And that approach is always very effective, in particular Latino populations and other groups as well, right? Because of the sense of confidence, the security, the privacy, the support that the family provides 365 days of the year, right? So I want to just say thank you both for describing your services. So I'm going to ask you the following question. So here's Fred Sandoval. He's looking for services, and he's driving by Amanecer, and he sees the name Amanecer, and he says, oh, wow, this might be an organization where they have Spanish speaking staff, because it says right below there a tagline, here to serve you for your well-being. So you already helped me pay attention to your signage. So I walked into your organization, and now walk us through what that's going to look like for somebody who might literally walk in at that very moment because they saw your signage, and they're feeling, now's the time for me to go ask for some help. So Diana, walk me through that process a little bit, and then Emmanuel can add to that, right? Because imagine somebody listening, and now you're going to give them the roadmap to get to the two of you. So let's try that as an example. So Diana, please go ahead.
Thank you, Fred. And I think, thank you for asking that question, because Anna, you mentioned we have so many acronyms. And so I can imagine, someone wanting services and listening might be like, well, how do I know which program, I can benefit from? And so our agency has done a really great job. We have a really great intake program. One of the few agencies that does it this way, in that, Fred, you're walking in and you're saying, I'm interested in services, or I need services. So we have a program that's dedicated on being the initial contact for anyone that is expressing wanting services. And there's therapists, they're able to do a comprehensive assessment, to kind of see what the need is on that spectrum. Is it a lower end? Is it something in our early prevention? Or is it something, higher end? And so they're able to do that, and they're able to see, okay, Fred, this is what you've said is the need, and this is the program that I think would be best to fit that need. And then they are able to connect you with a therapist, whether it would be in my clinic, it would be with the adult clinic. And then the therapist would call you, and we have timelines for this, because sometimes the need is very high. And so we're calling you within a certain timeline to say, I'm following up on your request for services. When are you available? And we're able to schedule you with a therapist to start that process. And, it really is throughout that process that we're also building that relationship. We're getting that information. We're getting to learn what is it that we can do to support Fred. And then we are able to make a treatment goal with you. We're able to say, okay, this is what you're saying, Fred, that you need, and what are we seeing that can support you with that? And it's a collaborative approach. We're working together with your input to try to, or the family's input, to determine how we can support you. I don't know if you want to add anything to that, Emmanuel.
Yeah, actually, very quickly, just kind of in addition to all of that, like I think one thing that is really important is that if you're walking by our office and if you decided to come in and just inquire about services, one thing that you're definitely going to be welcomed with is, or one thing that you're going to notice that you're going to be welcomed with a smile and just and if you are Spanish speaking, yes, you will encounter someone who is Spanish speaking. We do have staff that are Spanish speaking. Both of our current intake assessors are Spanish speaking, so they can provide that service to English and Spanish speaking in Spanish speaking individuals, because we know how we know that especially within our Latino community, it can be very discouraging to ask for services if there's already that communication barrier, because there's already that initial sense of worry, anxiety, maybe embarrassment of even asking for help, and then having to encounter someone who doesn't even who won't you feel won't be even be able to understand you is going to just add another layer and really discourage the individual from even continuing on with services.
Yeah, wow. All I could say is thank you. I think it really helps to show that for folks who are now thinking about reaching out to someone, you've helped already kind of ease their worry or their angst, right? Because in part of that is, this is precisely what makes the mental health field so important. It's about how we look to take care of people's well-being, and we help them in their recovery or in their healing and in their efforts, because they bring that to the table, right?
Right.
They just sometimes need questions, or they're trying to make sense of their challenges or circumstances. So I want to say thank you to both of you, and I want you to know you got a little shout out here from folks that are joining us, and they want to say thank you for sharing about the work that you do. And so you can already tell people appreciate that, because this is how people then not only get to learn about how to get help, but who to get it from. And then the goal is to ensure access, right? It's one thing to know about something, it's another to actually get those services. So Anna, I think all I could say is this has been just incredibly informative for not just the two of us, right? But also
Right.
for the folks that are going to continue to listen about Amanecer and their work. So you can go ahead and grab that next question there,
Okay.
and let's go there.
Absolutely. And before I go to the next question, though, I just wanted to ask a follow-up question to Diane. Diane, you spoke about a timeline, and I know, being a member of the community out here in California, particularly Los Angeles County, I know sometimes those timelines can be long, and as Latinos, we go in and, it already took us a whole bunch to, of courage to just go. But then, if we get, something like too far out, we might not come back. So what is your timeline like? Because I know that we have also been, because of the impact that COVID-19 had on our communities, right? Those timelines have it seemed to be longer, and I know of folks that, sometimes, they have to wait, several weeks before they get services, and if we're having an emergency, right? If it's a hospital discharge, so on and so forth. So did you want to, can you share a little bit more about what the time frame is for services on an average with Amanecer?
Sure. No, that's a very important question. And absolutely, COVID did impact that. Right now, I think we're now seeing more professionals coming back into community mental health. But during COVID, and especially with telehealth, a lot of we did see a dip, in the availability of qualified bilingual mental health therapists. And so, this has been a huge change, not just for us in Los Angeles County, but in all the state of California. There's been a huge reform in terms of access to services. And so, we go by the guideline of within initial contact, 10 days. But even within that, we are very honest and clear of where we are at, because again, sometimes, as you stated, there's just so much need and there's only so much that we can provide. And so if at the time of us, doing that initial kind of assessment with a potential client, we're hearing, this high need, then that's where the intake department is so key, because there are therapists there that can kind of assess and say, I don't think we're going to have a space here and the need is high. Let's try to refer you. And we have that connection within LA County and other organizations, and we can see who is open and who can meet your need. And so we're not leaving people, waiting and just to see what's going to happen. And also too, people have lives, they have, we have, parents that come in and they have their, they have to drop off their kids, they have work. And so we're really trying to also see what is going to be the best fit, and that we can support you, and that you're going to be able to commit to be able to come and really provide that space and time for yourself. And so we really do, within 10 days, make the contact, and then are scheduling with clients. And sometimes that may look a little bit different, but we're always communicating with everyone. This is where we are at. Are you okay to wait? If not, let me try to see where I can connect you.
Excellent. Thank you for that. Because I'm sure if it crossed my mind when you spoke about timeline, I'm sure it also crossed the minds of our listening audience. So thank you for that. And before I go to the next question that we had, we do have a comment on the chat from Dolores, and she says that she's curious to ask the panel if there is funding resources for naturopathic doctors, medicine, other incredible resources for holistic healthcare and overall well-being, such as alternative health treatment, acupuncture, hierberas, or curanderismo, or perhaps beginner-friendly, accessible, restorative chair yoga, meditation classes for anxiety, depression, etc. Do you offer that holistic approach? I guess it seems like the question is.
Yes, Diana, go ahead.
Yes and no. In terms of funding, if we can fund, that, we're limited to our funding, which is provided by Department of Mental Health. And so, we do have to follow the guidelines that they have for that. However, there are certain programs where we do have a little bit more flexibility to be able to support additional kind of resources that will aid in the overall goal of helping the treatment, or kind of the goals that a client has. So certain higher need programs, we are given some, additional funding, as well as, for example, a program such as the Trauma Recovery Center, that we have a little bit more flexibility with being able to provide additional kind of funding for, especially for alternative. What I will, and I say yes and no, because what we will do is, if there is a need and we're unable to do, to fund it directly, we have, again, amazing case managers who are out, doing consistent research, are out in the community, are sharing resources together, and are really trying to connect our clients to these resources if us as an agency are indirectly able to purchase. So while we sometimes can't directly, we will definitely do our best to try to connect if we identify that this can be a significant strength to the client in their goal. I don't know if you were going to add something else to that, or that too, Emmanuel.
No, yeah, I think you covered it pretty well. Yeah, I was gonna mention case managers, and just again, yes and no to that question. I mean, and also, but ultimately, we do take into consideration what path the clients that we service want to take. And yeah, because of due to our funding, there are, like Diana said, there are regulations and guidelines that we have to abide by. But if they feel like taking a more holistic approach and really trying to go, that's where they'll feel comfortable. That's where, like Diana said, that's where our case managers will come into play, who do just amazing job, and who really do care about care about our clients and just making sure that that our clients feel comfortable, but that also that they're working towards meeting their goals and objectives.
Absolutely. Well, thank you for that. And I just want to let you guys know that Teddy Valenzuela is watching, and he's sending a shout out, and he's saying, great job, Diana and Emmanuel. And thank you, Teddy, for watching. He is the CEO, right, of Amanecer, or executive director.
She's the
Executive director of Amanecer. So happy to have you here, Teddy. So a shout out to you, and thank you for watching. And thank you for being part of our Pláticas, right? Fred, did you want to ask the next question, sir?
Sure, absolutely. Yeah, this is great, and thank you for reminding us all of the realities of how the mental health system works, right? And where the needs are, and the types of services needed, and the scope to which you can practice and do the work that you do. And it's just so significant for being able to have your services available in the way that you make them available for people who are without income, people who are on a sliding fee scale, for people who are on the Medicaid program unique to California, and all of the other insurances that people may have to cover for services, right? So that they can afford to get the service. And I so appreciated the question about naturopathic physicians, because it happens to be my daughter's a naturopathic physician. So she's licensed in California, and the holistic approach that Dolores was talking about is something that oftentimes people want to be able to benefit from, right? So that their emotional well-being, their physical well-being, and even their spiritual well-being is attended to. So thank you for the question, and as other questions come up, we'll share them with you. So I want to move us over to another dynamic in the communities, right? And it's across the nation and across the globe. And this concept of stigma, it's that one cell that tends to do things that we don't like it to do, right? It tends to label people in a way that gives them a negative connotation. It's a way of trying to identify people as if though there's something wrong with them. So the words we use, the titles that we give to apply to them. So calling people with schizophrenia, schizophrenics, for instance, or referring to a person who is struggling with addiction as an addict. So the words we use, the labels we use, the approach that we use for people who are experiencing these particular behavioral health challenges oftentimes is an added burden. There's the burden of the illness, and then there's the burden of stigma. So stigma is one of those things we all have to combat, right? Because of the way it works, the way to do that is confront it, challenge it, to change it, because oftentimes people don't know about what a person is experiencing or what they're suffering from. So as a treatment agency and a provider, you probably hear this oftentimes, is why they didn't come in. They'll say things such as, well, I didn't want anybody to know that I'm having emotional problems, because then the word will get out. And people are trying to protect their privacy and their confidentiality, right? But stigma is affecting many of us across the country in terms of our work. And I want you to share a little bit about, your approach to addressing stigma as it applies to the people who you serve in your organization. So Diana, let's start with you, and then we'll go over to Emmanuel, and just would love for you to kind of weigh in on this. So go ahead.
Sure. I think this is an important conversation that needs to be had times. I do think that mental health in general has come to be. And particularly within our Latino, community, and within our Latino, culture. I saw a meme the other day that's like, we believe in Chupacabra, La Llorona, but we draw the line at anxiety and depression. We can't believe, or we can't accept, that that's a reality. And so, with stigma, I think first is the understanding. If someone is coming in and saying, well, I don't believe I have this, or I didn't want to come in because I didn't want to be seen as weak, that's part of us in terms of helping professionals. It's information because it gives us an understanding of there's a historical factor typically when there's stigma. And so we tend to see that this is kind of like a generational thing, that this has been like families, of long-standing history of this unacceptance of, mental health. And it's things that, we can accept if someone has diabetes because it's something tangible. We can believe it, we can see it, we see the side effects. But with something like mental health, it's something that's, abstract. And so we really have to first, as a professional, we want to understand, where is this coming from? What are the beliefs? And typically when you take on this approach of staying curious and trying to, really understand, you do get to the root of the problem. And then you are able to gently start to really reshape and really try to help kind of reframe, what weaknesses or the understanding. But that work is a long time, because especially in my program as an adult, we're talking about sometimes years of someone believing something. And it's to reshape that, it's really challenging. I think, in adults, it really has to be something that they want to challenge or that we're working on. I think Emmanuel, it's probably different because he's working with parents and children, and parents not accepting them. But for adults, we use it as part of their treatment in terms of helping them understand and helping them accept, and that it's okay. But that process can take a very long time.
Yeah, really good point. Yeah, that's right. That's a really good point. So that we take into account that part of what happens is what we've learned throughout our lifespan can't be undone magically in a session, right? It just doesn't work that way. It's because the information that you've learned and compiled over years has led you to have a particular way of thinking of things, seeing things, believing in them. And sometimes you may have maybe misinformation that's embedded in that without knowing it, right? So thank you for bringing us home to that reality, right? And it kind of, as you said, and it'll segue to Emmanuel here in a second, is with parents, right? Sometimes whose parenting style do we follow, right? Who is the person who is role modeling parenting for us? Because I have to tell you, I don't think I ever took a parenting class in elementary, junior high, middle school, or high school, or even in college, right? So I didn't really get any formal education on parenting, right? So I learned it from watching other parents, right? And sometimes we have some parents who might be very stern, right? And they might decide to use chancla as a way to kind of straighten up their child, right? Because if you do this, I'll do this. And, so how does that kind of relearning take place, right? So thank you, Diana, for reminding us that how does that happen? And Emmanuel, because of the work you do with parents and family and children, and the way stigma plays into that. Say a little bit more about that.
Yeah, so and thank you for that, because that actually does tie in really beautifully into the way here in the children's department how we work with the child and the parent. I mean, one of the main barriers in terms of challenging that stigma with our clients is, again, like we're trying to teach we're trying to engage the child with therapy, with services, but at the same time we're really trying to get the parents buy-in also as to this is what therapy is going to provide, while also still trying to break that stigma of what therapy is and who therapy is for. I mean, and again, like this is a multi-generational thing. Case in point, I mean, and just a little bit about my own personal experience with this. When I graduated from my master's program, and we were having the fiesta at my parents' house, someone asked my mom, "Oh, like what is it that your son does?" I will never forget this. I heard her say, "Oh, él es un loquero," and I'm like, I heard that, and I'm like, I had to slide into that conversation. I'm like, what, like, what am I? And her pretty much saying, yeah, like you work with crazy people. And then that's when just like that whole conversation with her starting, I'm like, no, it's not crazy people. It's just, I work with anyone who just needs to talk. Like we all need to talk. We all deserve it to ourselves to really just kind of check in with someone every now and again. And and one thing that I explain, trying to break the stigma of what therapy is when I'm working either with an adult or with a parent, is like this. Okay, so if you have a car, you know that you should go get a tune-up every couple thousand miles to make sure that the car is running right, the oil is changed, all the fluids are changed, brakes, everything, lights, todo, right? Why won't you do that for yourself?
Mhm.
Or like why won't you go in and do a tune-up on yourself? Just talk to someone for an hour for a few weeks and just let go of everything. Maybe there's something that comes up that you want to explore, or maybe you just needed those 3-4 weeks of just of allowing someone to unconditionally and with no judgment listen to what it is that you have to say, to be given the gift of having a full hour of like having someone listen to you with pure acceptance. Like, I think that is what therapy is. And I think that is something that here at Adamana said is what is what we aim for.
Wow. Well, thank you for summarizing it the way you did, right? Is the relief that comes from being able to reach out, and how powerful that is to release so much that's bottled up, right? And so thank you, Diana and Emmanuel, for kind of expressing that so that folks can really kind of hear this, right? Because it's not just therapeutic, as we call it, but boy, what it does, it brings relief. It reduces the person's stress or their anxiety because they were thinking, what's wrong? Why am I feeling this way? Because when you are experiencing these symptoms, causes a little bit of confusion, but the confusion can be sorted out when you have someone objectively being there to listen to you. And it kind of reminds me of my mom. You kind of said it in a way that just now reminded me about my mom, right? In my mom's life, she never once used the word schizophrenia and never once used the word schizophrenic, or never even used the word mentally ill when talking about her daughter. The community, the treatment community, referred to as a chronic paranoid person with schizophrenia. So she had a diagnosis, and she had a disability that was probably one of the most powerful illnesses that exist in humanity, that impacts a person's thoughts and what it does for the person to function on a regular day-to-day basis. And she's only a year and a half older than I am, right? But never once did you ever hear my mom use those words. And what she would say, mi hija tiene una enfermedad. And she was so spot on, right? Today, every MD would agree with her, right? Because what she was describing is an illness. It's an illness of the brain. So thank you for letting us breach this subject, to kind of really be able to share these thoughts. And you have been just so wonderful in doing that. So Anna, here we are. I can't believe the hour is just about to run out. And I'd like us to kind of have you bring us home. And this way we can, be able to benefit from the takeaways from Diana and Emmanuel. So over to you, and then we're going to start getting ready to have to wrap up our plática for today. But go ahead.
Absolutely. Yeah. The time flies when you're having fun, right? It's amazing how quickly the hour went. Even when developing the questions, right? We're like, are those enough questions? And then when you see, next thing you know, it's like the hour is gone, right? So yeah, most definitely. So again, thank you to both of you for being here. And now this is what I call the $1 million question. So how can people watching and listening today reach your organization and get the services that they need? And I'm pretty sure Amanecer has different locations, not just in Los Angeles, but maybe other surrounding areas. So how can what would be the best way for people watching and listening today to reach you and say, hey, you know what? I need services. I don't know what kind of services, but I need help. Diana, did you want to respond first, and then we'll go to Emmanuel?
Yes, absolutely. So I know that the link for our online referrals is going to be shared. So we do have what our main office is in Los Angeles. We do have another small office in another part of Los Angeles. So we really are centered in Los Angeles. Most recently, through our Trauma Recovery Center, we are going to be able to provide Trauma Recovery Center services in Central California, so in Stockton and Bakersfield. That is going to be starting in the next month. And so if someone is interested in our service, definitely check out our website. Again, that link will be provided, as well as in our website, there's numbers to call. And so that really is the best way to start that process if you are seeking or in need of accessing services.
Okay, wonderful. So I know that we will be sharing that information for those watching and listening to us, and those that are going to watch in the future are also going to have this information. But it has been wonderful to learn more about Amanecer, and I'm glad to hear that you guys are going to be expanding, in California with services, because mental health services are so needed for our community. Our communities sometimes don't have access to those services. So the fact that Amanecer is going to be, is doing that for our communities and making more services available in more areas is wonderful. So thank you for that. Thank you for all that you do. I know we have a couple of shout outs on the chat. It says, thank you, Diana. What you're sharing feels so impactful and has deep resonance. That was a comment from Dolores. And it says, wow, that was deep, Emmanuel, pero super real in our communities generally, yet it is an individual's choice to develop the courage to shift the paradigm for self-liberation. A lofty way to describe simply to engage our warrior ways to rise. I commend you for choosing your path authentically. So again, our audience is really grateful for everything that you guys do. So again, thank you. Fred, back to you.
Well, gosh darn, I want to make sure before we kind of give our little mini farewell, because really, even though today's conversation stops, it really continues in the recorded Pláticas. So that's going to be great. But Emmanuel, maybe you can just kind of share with us a takeaway that you want folks to really leave with today, so that this way, with all that you've shared, and thank you so much for being here with us today. I just want to give you an opportunity to see if there's another takeaway you want people to take away from today. So go ahead.
All right. Yes. Thank you, Fred. Really, kind of the biggest takeaway that I want those listening in on this is that, just really take a moment and really reflect about especially what the last 3 years have been like for all of us. I mean, I know a lot of us have experienced hardships, unfortunately, deaths in the family, deaths of loved ones, close friends, just, and also given everything that has been happening with the economy, like there's a lot that is having a severe impact on us, and that continually will have a severe impact on us because of everything that's been happening with COVID. And really just coming in, even if it's to just do a check-in and just see, like, maybe is there something that I really need to work on that maybe I'm not giving myself the opportunity to really process because I'm so busy. And I get it, all of us, I know all of us are busy. We're all working really hard. But we also owe it to ourselves to really we also owe it to ourselves to take care of ourselves, not only physically and medically, but also mentally.
Wow. Yeah, that's beautiful, And in our Raza community, as I like to say, is we're really kind of walking therapists. We just don't know it, right? Because, have you ever noticed when we greet each other, the first thing we ask is, ¿Cómo estás? How are you? That's a powerful question, right?
Yes.
Because it's the first question to connecting with a human being, right? You're expressing your emotion of caring, you're expressing your emotion of affection, your sense of being able to want to take care of your brethren, your brothers, your sisters, your community. So we're naturally in that space. We just have to have the private space and then be able to talk to people who we know will, be able to give us that advice, right? Because our compadrazgo, right, our whole natural support system is built around that very thing, is others helping us and us helping others. It's a reciprocal process. Diana Guerrero, Emmanuel Reyes, and of course my incredible co-host Ana Chavez Mancias. This has just been a wonderful plática, and let's not let it stop. Let's make sure that the recorded version gets shared and that we continue to have this dialogue so that other people can hear it and chime in on this very example. And to the Facebook viewers that were here with us today, thank you for your comments, your wonderful questions. And because this generally happens around people's lunch times, don't be surprised that people have brought in a little taco plate there on the side with a little soda on the side, because they were probably listening intently, but they didn't want to leave their cameras. And there they were listening to Diana, Emmanuel, and of course, all the wonderful folks at Manicet who are doing the work every single day. So with that, I want to say thank you to all of you, and we welcome you to our next set of Pláticas. And until we see you again, muchísimas gracias, Fred Sandoval, your Salvador, and we look forward to seeing you soon. Muchísimas gracias. Take care.